Our next speaker has been a member of the DiepCFoundation community and has become a fierce patient advocate for breast cancer and good health right here in our own community. She has been instrumental in helping raise funds for the DiepCFoundation, and I'm very grateful for that. Please welcome our first patient speaker, Miss Abi Iyer, known to her friends as Abi.
Thank you so much, Terry, for giving me this opportunity. Can everyone hear me? Okay. Thank you so much for this opportunity. I don't have any slides today, honestly, because that's what I do at work. Every day, in and out, I just, make slides for my living. And, I'm one of these girls who didn't check a lot of the comment boxes, right? What are those comment boxes? And you all might remember when you are at the diagnosis table, when you're going there for the first time, they ask you to fill this form, right? And I barely had any boxes to fill, meaning I didn't have a history of cancer in my family. And, I have never had alcohol in my life. I was a non-smoker. I've never had meat in my life. I was not on birth control pills. I was just puzzled, what went wrong. And I was also this person who has never paid attention to any of the breast cancer awareness campaigns that was happening around me. I never ran the Susan Komen marathons. My life was very small and simple. In fact, my GPS would have two common destinations, which is work and home. That's it. And that was pretty much my life. But if there was a box for stress, trauma, or mental health, I would have checked it a million times. And thank you, Dr. Chung, for highlighting the importance of managing stress and emotional health, which I had no awareness until that point. Well, I'm Abi Iyer. I'm a senior program manager with Microsoft. I've been married for about 23 years. I have two wonderful kids. Now, this all sounds beautiful, like a glossy cover book, right? But I've had many pages filled with challenges and stress and trauma. I was raised by my mother. She's single. She was a victim of child marriage, dowry, and domestic violence. And back in India, that was a big taboo. So my life as a child, I've had to navigate a lot of social taboos, a lot of challenges. And I get married. I study well, I get married, and my married life also had some external toxic elements that I had to navigate as part of my married life. And I was taking everything as common, right? I'm supposed to go through this. I cannot complain about it. And outside, I'm just putting a beautiful smile, right? That's what I'm used to as a child. I'm not sharing any of my struggles. I'm just smiling. I'm being happy. I wanted everybody around to believe that I'm having a perfectly normal life. But inside, I've been carrying a lot of baggage. Then I become a parent, and my son, he gets diagnosed with autism spectrum disorder when he was 3, and that was a big blow to me. So I'm beginning to walk that path of unique needs parenting, and almost 7 years go by in his treatments. I'm juggling work, family, and time flew like that. My son was doing better. I was almost 39. First time I'm looking at myself in the mirror and saying, where did all the time go? What did I do for myself, right? But I didn't realize I'm already in midlife crisis, right? But I want to do something for myself. I'm kind of waking up, but the world started shutting down with COVID, right? So now I'm at home and unable to go around and do a lot of stuff. Like our normal life was challenging. And at the time, I noticed a very small change in my right breast, which is a very small change in shape that can go unnoticed by 99% of us. For some reason, I just kept staring at it in the mirror, and I was wondering what's happening. You know, this breast is looking odd. I can't tell anything of it. I'm not seeing any signs like, you know, there's no swelling, there's no pain, there's no discoloration, there's no discharge, there's nothing, but just the change in the shape of my right breast, which I casually ignore and move on. But sometimes, you know, whenever I'm standing in front of the mirror, I pay attention and I'm saying, okay, you know, I need to pay close attention. And then one day I just told myself, why not just get myself to a doctor and find out what might be happening. So amidst COVID lockdown, I get an appointment to go to my PCP, and I convinced her to come in person and take a look at my breasts. She did the manual exam and dismissed there's nothing wrong, right? Because I had no signs. So I come home and I lost some more time. And I noticed a very teeny tiny dimpling, even smaller than the size of a mustard. I cannot pinpoint, but I if I see it in a particular position from a particular angle, then I can notice it. So after a few months, I dragged myself again to my PCP, and then I show her, something that I'm noticing. She does a manual exam again, and she tells me, you know, she doesn't think it's cancer, but she writes me a referral to a breast surgeon. And then I have to wait a couple months because of all the COVID lockdowns. I finally go in. My breast surgeon does the same manual exam, and she also tells me that it's likely not cancer, right? She's not worried. And then she said, when I'm ready, I can come back. Maybe it's cyst or something else that could be happening, because a lot of women go through hormonal changes at that phase in life. So I come back home. I, take care of things that needs to be taken care of, but not my health. So a few months go by again, and then the dimpling became a bit bigger. So now I go back to my breast surgeon and said, let's just find out what it is, because I'm losing my sleep over it. And she told me that she can write a referral to mammogram. You know, usually they don't do it until 40. I was not even aware of these conditions. She wrote me a referral for mammogram. Long wait times. I got my mammogram done. They found something suspicious, followed by needle biopsy. And then they wanted an MRI because they could not get clear information with mammogram because it's likely lobular carcinoma. So they wanted me to go and take an MRI so they had a better picture of the overall, mass that they were trying to look at. And MRI gave them a better picture. And all the diagnoses came back as positive for cancer. I was diagnosed with invasive lobular carcinoma. I had some nodes also being involved potentially. And I received all these diagnoses one day, and I shut down, went into a depression for a few months because I've already been dealing with a lot in my life. And I was not mentally prepared to go through what's ahead of me. But my family stood by me and gave me the confidence. And you can imagine I am this person who's trying to find someone that can relate to me in terms of what I was going through, because I'm from a background whose culture is very different. I have very different food habits. I couldn't find anyone who I can relate and talk to about this. Even if there were people, it's considered a taboo to talk about this, right? Even the word breast is a big taboo in my community, leave alone cancer. So I'm having a lot of fears, and I don't know where to find people. I'm not talking to, a lot of them. Even family doesn't know much. But I went for the surgery. They recommended right breast mastectomy, possibly because of the age where the lump was located. So I got my SMX done, and I knew I had to go into chemotherapy and radiation. I did that. Chemotherapy left me with lot of side effects. Pretty much, all the side effects in the book that my oncologist had to stop my treatment ahead of a few cycles, because if they continued, my side effects would hamper my living. And then I had 36 rounds of radiation. And that's when I realized I need to go for reconstruction. And I found through Facebook about this community. I joined and I was asking all the dumbest question in the group. And I'm thankful for one of the sisters from the community to do a phone call with me. And she walked me exactly what she went through. And she gave me a referral for a plastic surgeon. So I made up my mind. I met the plastic surgeon and I scheduled my reconstruction. And it was a long journey, right? Throughout this journey, I've asked questions like, hey, why is my right boob looking so bigger than my left, right? Why is my boob hitting my armpit? Why do I have dog ears? What is that Kendall thing? So many questions and, so many revisions. And the group has been with me throughout the journey, answering every single question and making me feel that I'm not alone. And when I was at the end of the treatment, I met Terry and I wanted to do a podcast with her. My first podcast was with her. By that time, I've gathered the strength to talk about my journey, the challenges, and how I've begun to turn my life around. And after the podcast with her, now I do a lot of breast cancer awareness talks and campaigns, both at Microsoft and in my communities. I've also started doing pageant. I recently won Mrs. Elite Universe America title. I'll be competing in Mrs. Universe this October. And I am honoring all my ramp walks to all the survivors who have been in this journey, right? From getting diagnosed to being stuck in the bed to walking the wrong way. Today, I'm very thankful for where I am today. And I want to leave you with a couple quotes. I know I'm running a little bit over time.
Okay.
I want to leave you with a couple powerful quotes. And you can repeat after me if you want. It's okay if you don't want to. I've learned to love, respect myself after this journey. It's been empowering to the core. And I've read a lot of works. Louise Hay is one of my favorite authors who has turned my life around. The quotes are, I'm open and receptive to the healing energy of the universe. I release all resistance and allow my body to heal. Finally, I love and accept myself. Thank you.
I noticed something when Abby was up here at the podium. And I have a feeling that many of you sitting out there affected by breast cancer, those of you not affected by breast cancer who go through life, when she began talking about her diagnosis, I noticed a little bit of hypervigilance, a little bit of tension in her voice. And yet, at the end of her talk, she shared with us how she came out of that. Just, often it's called like the cocoon, the butterfly coming out of the cocoon. I love that, Abby. Thank you so, so much.